Good morning, class. Today we are going to learn how to accurately document a patient's obstetric history using the GPTPAL acronym. This is a vital tool that helps us understand a mother's risks and clinical needs the moment she enters our care. G. Gravida, the beginning. First, we look at gravida. This refers to the total number of times the woman has been pregnant regardless of the outcome. Whether the pregnancy lasted a few weeks or went to full term, it counts here. We always include the current pregnancy in this number. P, parity, the T and P, term and preterm. Now we look at the outcomes of those pregnancies. We divide parity into two specific categories. T, term births. This counts any delivery that occurred at 37 weeks gestation or beyond. It doesn't matter if the baby was born alive or was a stillbirth. If it reached 37 weeks, it is a term birth. P, preterm births. This counts deliveries that occurred between 20 weeks and 36 weeks and 6 days. These patients may require closer monitoring in future pregnancies due to the risk of repeated preterm labor. A, abortions and miscarriages. Next is A for abortions. This includes both spontaneous abortions, miscarriages, and elective abortions that occurred before 20 weeks gestation. If a pregnancy ends after 20 weeks, it is not an abortion in this system. It becomes a preterm birth. P. L. Living children. Finally, we count living children. This is the number of children currently alive. This is the only part of the acronym that counts the number of babies rather than the number of pregnancies. For example, if a mother had one pregnancy that resulted in twins who are both healthy, her living count is 2, even though her term count would only be 1. In conclusion, putting it together by using GPTPAL, we get a clear picture of a patient's reproductive journey. If a nurse tells you a patient is a G3, T1, P0, A1, L1, you immediately know she is currently pregnant, has one child at home, and has experienced one loss in the past. This knowledge is our first step in providing safe, empathetic, and evidence-based maternal care. Here is a quick clinical tip. Guys, remember that multiples, twins, triplets count as one movement of the G gravida, T term, or parity columns because those columns track events, while the L, live babies column tracks individuals. Here is your homework. A woman is currently pregnant. She previously delivered twins at 38 weeks, had one miscarriage at 10 weeks, and has one child born at 32 weeks who is alive. What is her GTPAL? Drop your answer in the comments section. Shalayipo.